So I want to talk to you today about the potential link between certain types of illness, especially infection, and neck pain. We often see people come in with neck pain who've come in and they're not quite feeling well, and they start looking for a physical cause for their neck pain. Of course, that's been reduced this year with COVID, with people being restricted to their houses with any kinds of symptoms. But this is something we've seen over the years where people have been a little bit unwell and developed this neck pain and then come in looking for care for their neck when their neck is not actually the things we need to work with them for. So there's two key things I want to talk to you about today. So the first one is the role of toxins, especially what we call exotoxins and endotoxins. And these are released by infection, primarily via bacterial infection. And what basically happens, they're liposaccharides, okay? They're liposaccharides, and these liposaccharides form part of the actual wall of the bacterium. So when the bacteria gets broken down, they get released, and as they get released into the bloodstream, they then have adverse effects on the system. So some people will see this as pain as their immune system gets wound up and they get a little bit inflammatory. Other people will develop things like fevers and chills when these toxins actually hit the area on the central part of the brain that is responsible for temperature control. So that's one aspect of what we see with infection and neck pain. The other one is what we call a viscerosomatic response. Now, viscerosomatic, as the word says, viscero meaning organ, somatic meaning body, so this is referred pain from an organ to the body. And this is something that there's not a lot of research in regards to this, but it's something that has been observed in clinical practice, and it's still a little bit hotly debated, but we've seen it here as well. And that is that the parathyroid gland, which is a little gland that sits on either side of your thyroid. So the parathyroid gland is responsible for producing a hormone known as parathyroid hormone, PTH, parathyroid hormone. And parathyroid hormone has a really important role in our immune response, which often gets missed. So parathyroid hormone is actually responsible for the activation, to a great extent, of vitamin D. So when we have a response and we have an infection or a virus coming into the system, especially a viral infection, what happens is that our stored form of vitamin D, 25-OHD, is actually converted to our active form of vitamin D, which is 1,2,5 vitamin D, which is used to activate our innate immune cells. So it actually binds to the cell itself, which turns the cell on and gets it into like an attack mode and starts fighting. And this is where we're starting to see links between COVID and vitamin D levels as well, potentially through this system of innate immune responses. So when it initiates our innate immune response, that kind of kicks our system into gear and then moves down the path of actually starting to activate our immune system and fight off infection. So what does this have to do with neck pain? Okay, so one of the things that has been observed, and I use the word observed in quotation marks here because it's been observed, it hasn't been proven to exist, but one of the things that has been observed is that when we have changes in parathyroid function, for some reason or another, these muscles here, your levator scap muscles, are often affected by it. Now, the reason that is so important is because the levator scap muscle actually is one of the most critical muscles in neck function. We've already spoken about levator scap in previous videos. But the reason it's so important is as it comes down from the neck, it touches in that top area of the cervical spine through this area here, and as it comes down, it actually attaches to the shoulder blade, and it's one of the key stabilizers of the shoulder blade. So when the levator scap is not firing as effectively as it should, the net result of that is often scapular instability, and this can create shoulder problems, can create numbness in the hands when you go to bed at night and you're laying on it, can create a whole lot of havoc for shoulder complexes, elbows and hands. And again, it's one of the most common reasons that we see people having shoulder problems is dysfunction of levator scap. In addition to this as well, its upper attachments in that top part of the neck there can actually create major problems with upper cervical function, upper neck problem, which can further aggravate headaches, neck pain, migraines, things like that. So this is our really, really big problem through this area here, because if we're losing our levator scap muscle, not only are we going to lose problems, or not only are we going to have problems with the shoulders potentially, and problems with the upper part of the neck, but it also will affect stability in the lowest part of the cervical spine. It's one of the common reasons, or one of the common findings that we see here with people who are having cervical disc problems. So there's damage in the discs in their neck. And again, as we said before, this may be getting contributed back in some circumstances to part of our viral or immune activation patterns. So there's two different ways that we see here. I said this is not overly proven, it's more of an observed thing than anything else. But here's two things that we commonly see here, which are causes of neck pain that afflict people that often go miss when people have neck pain. Those of toxins when we have an acute infection, and those of viscerosomatic patterns when we have people who have chronic type of infections going through. So anyway guys, that's a quick introduction to how infection may potentially contribute to your neck pain. If you have any questions in any way, shape or form, just post them up or send me a message. Otherwise, remember it's all about adding life to your years, and we'll catch up in the next video. See you guys.